insulin, cortisone. Only one.
Essential drugs unavailable or hard to find, Greek patients waiting in line for donated medicines to keep them going. So who's to blame? As the financial crisis unfolded, multinational pharma companies stood accused of cutting supplies in the face of low profits and unpaid bills. But it's emerged the chaos also has its roots in the pace of Greek state reforms. Athens has yet to adopt an EU-style drug pricing system where generic drugs are cheap but more is paid for newer drugs. Uniquely in Europe, Greece maintains a constantly changing master price list to ensure that it pays the lowest possible prices for patent-protected medicines. This leaves Greek wholesalers with stock they can easily resell profitably and legally in the single market. So the wholesalers are profiting from price differences. It's better business for them because hospitals and pharmacies are often late or non-payers. That's because in turn they're not being reimbursed. And the nasty side effects, gaps on the shelves. The multinational drug companies have countered with supply quotas to try and limit these re-exports, but the ensuing shortage has left Greeks struggling to obtain about 300 critical drugs. Athens government regulators have responded with export bans and fines. Industry chiefs are pressing for a more realistic pricing system, giving wholesalers less scope to make a turn.
We have price bulletins that put the Greek price 20–30% below any price in Europe. And suddenly we have all these people that want to distribute medicines, the people that legitimately have as their job to drive lorries from Greece up to Northern Europe, and they'll make a lot of money. And then the government corrects the price after a month, and some people made a lot of money in the meantime, and patients didn't get their drugs. It's all very irrational.
Producers in Greece point out that drug re-exports aren't confined to their country. The health ministry plans changes. About time, say pharmacists.
Those who export are not the pharmacies, they are the companies. They can't make money here, so they sell their medicines abroad perfectly legally. We are the recipients of policies from abroad which have no connection with the reality in Greece.
And as long as the re-exporting continues, Greeks won't easily find the medications they need. Nigel Cassidy, BBC News.